All right. Happy October. Welcome to You're Such a Great Listener. This month we are talking about ADHD because October is ADHD Awareness Month, and we want to make some time and space to talk about that. Uh, Rachel and I are also very lucky to talk about this topic because this happens to be an area of expertise for Rachel. And this is really her wheelhouse. So we're not even like, just it'll be a lot more than just a basic conversation because Rachel comes at this with such a tremendous wealth of knowledge. So I guess I'll start with Rachel. What is ADHD?
Thanks, Orly. Thanks for the kind introduction. I actually started working with ADHD kiddos almost like 15 years ago. And at the time, schools were definitely diagnosing it, but we didn't really know what to do with it. And I want to just kind of acknowledge with ADHD Awareness Month next month or this month, depending on when this is airing, that we've come a long way, meaning like there's been so much education about ADHD over the years, that I think educators know more, parents know more, kids are getting assessed and supported earlier, and parents, because we know ADHD is genetic, might also be identifying that they have symptoms as adults, and that adult ADHD is becoming something that's more of a conversation. So I think ADHD Awareness Month as a standalone month, is really amazing for those in the neurodivergent community. And ADHD is it's a neuro condition, meaning that it has to do with brains and nerve networks and neurotransmitters in the brain. When we talk about ADHD, we're talking about a condition. We're talking about people who think differently, specifically might be struggling with executive functioning, meaning that it's hard for them to manage time functioning. So, how time management, it might be hard to stay focused, to concentrate, to follow directions, to pay attention. And then on the other hand, there's this whole piece of ADHD that we're just starting to understand more, that with executive dysfunction or exact challenges with organizing things, there's also difficulty organizing our thoughts and our feelings, and that especially the women that I've worked with over the years, really do struggle with managing their behaviors, their moods. So understanding how to organize your mood is actually not that different than understanding how to organize your time and your stuff.
That's really interesting when you frame it like that. I really
Yeah,
hadn't
right.
thought about it before. Yeah, like it's just about can you organize things and like get from A to B and keep things under control. And if you don't have that with your stuff, you might not have that with your mind in general.
Right. And bringing up difficulties, ADHD as the ADHD community is in a lot of education around the fact that there's a neurodivergent community, people who think differently, act differently, and aren't necessarily looking to be cured, but to learn coping skills. And I think that's where therapy can become really, really helpful. Coaching can become really helpful. Learning about ADHD can become really helpful because there are tools there. There's evidence based practice. There's a lot of research actually, on how to cope better, how to manage our time better. And we know, in addition to therapy and coaching, that medication plays a critical role in really supporting individuals, not just with executive functioning and focusing, but like the mood stuff that comes along with it, the anxiety, the depression, those close cousins of a lot of things.
So I'm going to touch on a lot of what you said piece by piece, but I wanted to start with this word neurodiversity. It's this huge buzzword. I think 5 years ago, I hadn't really heard that term before. So
Yeah.
can you share with our listeners what does that mean? Like everyone's using it, but are they using it properly? Does anyone know what it actually means?
Yeah, so neuro means nerves, like, right? So we have nerves in our brain, we have nerve networks, we have neurotransmitters, and the way that we think might be different. They've done fMRIs, these images of the brain, for people with ADHD, and there's a lot of neuroactivity in the brain, and the ADHD brain does look a little different. So neurodiversity is what I consider a big umbrella, and we can actually post some links later. If we think of neurodiversity as an umbrella term, meaning people that think differently. The term can be very, very limited to ADHD learning differences, so dysgraphia, dyscalculia, dyslexia, auditory processing disorder. So these are learning challenges, as well as autism spectrum disorders. So typically, those are the three main categories under the umbrella of neurodiversity. But within the neurodiverse community, there's a lot of discussion about whether to make it more of an inclusive term to include all of mental illness, all types of mental health struggles. So I think your question is really, really a great one, that the definition is evolving. And I think depending on who you talk to within the community of neurodivergent thinkers and people, you can get lots of different diagnoses and opinions.
Okay, so I want to shift to like, we're going to do kind of like a little myth busting session. So I have a list in front of me of what I think of as some really common myths about ADHD. And you can tell us if they're true or false, or because we always encourage our clients not to engage in all or nothing thinking, if there's maybe some, golden path in between true and false that is more accurate reflection. So,
And this is also rapid fire. We have not practiced
yeah,
this.
we
So
haven't prepped this.
Orly
Nobody,
Orly is
like
legit
this. I'm literally,
challenging. Okay, done.
I'm springing these myths on Rachel. Hopefully she's heard of them before. Otherwise, it'll be really amusing. Okay, so the first one I'm going to go with is ADHD is totally overdiagnosed. Everybody and their mother has ADHD today.
Right, right. So two things. Number one, I think in general, we are becoming more aware to people's challenges. So when we hear about ADHD being diagnosed, I think there's one, a genetic factor. So in families, you're going to hear more about it in your family because it's pretty much as hereditary. I've heard Russell Barkley say, a fabulous ADHD educator, that it's about as hereditary as height. So if in your family you hear a lot about it, yeah. Also, I think ADHD people are attracted to each other. So if in your friend group, you like, right, like if you're a friend group and everyone's kids are getting diagnosed, well, don't look that far away because likelihood is if there's one parent, there's going to be diagnoses of the next generation, and our generation didn't necessarily get diagnosed, right? Like there were kids getting thrown out of class. I remember in like fourth or fifth grade, someone was talking in class about going on his thinking medication. He is now a very, very successful um, person in tech, right? He was already thinking outside the box back then. But we didn't hear much about kids getting diagnosed, and we definitely, when we're thinking about kids with ADHD, can see symptoms in ourselves and within our friend group, because I think outside the box thinkers, creative thinkers, are attracted to each other. So you might see it more in certain families, in certain friend groups. There is an evolutionary basis of ADHD that's really, really interesting. Some people think of like if you have immigration waves, the United States in general, people had to risk a lot to move to the United States from their home country. Risk taking is an attribute of ADHD as well. So what do I want to say? I think it has to be carefully diagnosed. And when it is diagnosed properly by a neuropsychologist, by someone who really knows what they're doing, that we know that we could prevent a lot of the risks of undiagnosing and having kids labeled as bad or lazy. I think that can definitely happen. And also there's a differential diagnosis here. That means that like when we are seeing the qualities of ADHD, that we really want to make sure that kids are not showing symptoms of trauma. I think that's a really important point to make, especially for parents and educators. If out of nowhere kids are starting to act impulsive, angry, have difficulty focusing, daydreaming a lot, that you see a change in their behavior, that can definitely be a sign of something bad happening to them, and that there's been a response that could look like ADHD, but might actually be a child becoming hyper vigilant, meaning excitable and easily and irritable, or hypo, which means withdrawn and daydreamy.
I think that's so important. So just to summarize, if you're seeing a lot of it, it could just be that you're drawn to people with ADHD. Make sure you're getting your diagnosis from someone who's really an expert in it.
Yeah.
And there's a difference between, I've always known in my gut that my kid would end up with an ADHD diagnosis versus these symptoms are coming out of nowhere. All of a sudden, my kid is acting totally different and uncontrollable. And that's a really important piece to convey to whoever's doing the diagnosing. It's that this is new.
Yeah. So to meet diagnostic criteria, it means like when you're doing the check on whether or not my kid has ADHD, it's not something that comes out of the blue. You want to think back to, was my child the Energizer Bunny, the hyperactive ADHD kid, or was my kid that adorable, dreamy, would sit on the couch for hours just looking up and singing songs to themselves, So to have an ADHD diagnosis, you definitely have to have that feature of being the symptoms being there since early childhood.
All right, next myth. ADHD only impacts boys.
Ooh, well, I actually have on my disaster of a bookshelf behind me a whole stack of ADHD books for girls and women, and I think this is actually an area of research that we're just starting to touch. I'd like to do a shout out to one of my favorite female ADHD advocates, Jessica McCabe from How to ADHD. Her YouTube station, her recent book, her talks are all just amazing, and she really has done a really wonderful job of bringing awareness to ADHD in girls and women. I would say that the presentation of ADHD in women might look different. And we know from the DSM in general, when men and women are diagnosed, that it tends to favor men. It tends to sometimes exclude the experience of women. And in my practice over the years, I've worked with many, many women who really feel that their ADHD impacts them most in something called rejection sensitivity, that they're extremely sensitive to feeling rejection, to criticism, to hurt, and that they have a really hard time regulating and organizing their thoughts and feelings, which is what we were talking about a bit earlier. So that is not like a typical feature of what we think of when we talk about ADHD. We think of hyperactive and go, or, spacey, but ADHD in many women, for girls, it impacts them in the classroom. Do they identify as lazy, crazy, or stupid? That's the name of an old ADHD book, but I think it really resonates for a lot of ADHD girls, that they get in trouble, that they get kicked out of class, or they just fall behind, that they take on that I don't need to be good at X, Y, and Z because I'm lazy. But maybe it's that school's just really hard and they're not meant to sit in a classroom without the necessary support that they need. We see for young women entering the workplace or graduating from high school or college, dating is difficult. Starting new jobs is difficult. Moving out on their own is difficult. So these times of transition. And then there's that whole piece of being in a relationship and motherhood and what that mental load looks like for a woman with executive functioning challenges. And, we've talked about that in this podcast before. So yes, ADHD is definitely something that impacts women as well. We're 50% of the population. But I think historically the research and the attention has veered away from their experiences.
Okay, myth number 3.
Or at least frozen for me.
If we had better parenting, we would have less ADHD. Wow. If you knew how to control your kid.
That hits close. Yeah, so we know that typical parenting doesn't really work. Typical parenting doesn't really work for the neurodivergent kid because they're super creative. They have lots of superpowers, and with those superpowers comes lots of powers. So that, we don't want to enter into power struggles. So one of the things for parenting ADHD kids, when we think about executive functioning, we also think about rejection sensitivity, of sensitivity to criticism. It is really is really parenting that is individualized, that is positive, that builds on their strengths. ADHD kids are much more vulnerable to trauma. They are much more vulnerable to being bullied and comorbid mental health conditions. So thinking about other mental health conditions that affect the population, ADHD kids are much more vulnerable to those. So anxiety, depression, eating disorders, self-harming behaviors, substance abuse. So left untreated, our kids are vulnerable. So our parenting has to really meet our children where they're at. And, the same, when we think about ADHD, there's not one way of describing ADHD. There's ADHD, attention deficit hyperactivity disorder, predominantly inattentive, predominantly hyperactive, combined type, with other comorbidities. But I think the best description I've ever heard of it, if you met one person with ADHD, you've met one person with ADHD. And then I'd say the same thing about parenting, that parenting kids with ADHD has to be really, really individualized. You have to think about each kid and their specific vulnerabilities, and that, it's a hereditary condition, meaning that you didn't necessarily pick your genes. Did you pass on brown hair, blue eyes, height? I recently went to an endocrinologist with one of my kids, and the endocrinologist asked me, how tall are you? How tall your husband is? Okay, this should be your trajectory. I wish someone would explain ADHD like that as well. Like, it's a condition that is highly hereditary. And, the challenge is not, did you poorly parent, but how do you parent so that your kid can thrive?
I like how you frame that. That's really lovely. Like, how do you parent, especially keeping in mind that it's hereditary, so you might have some of these same challenges that your child has. Um,
100%.
okay, the next
Asking
myth I've heard.
Yeah.
Hmm?
I was just saying, you don't have to do it by yourself. Like,
Yes.
there are communities of neurodivergent parents. The one thing about the neurodivergent community is they are there for each other. So if it's online, if it's through CHADD, CHADD, if it's through Attitude Magazine, there's great resources online. There's great communities, Facebook parenting groups. Some of these cost, some of them are free. And the amazing thing about the neurodivergent community is that they're really there for each other.
Okay, so the next myth, and I've heard this myth and its opposite. It's both. So, first, that the only thing you need to do is just medicate the kid and move on, right?
Yeah.
Stop putzing around with all sorts of other things. And the other one is way too many kids are on meds. We need to stop putting kids on medication. We just need to, they just need to sit down and do what they're told, and it'll be okay.
Right. Right. So, first line of treatment before medication for little kiddos is usually behavioral therapy. When we're talking about early diagnosis, early detection, we're talking about parenting support, we're talking about OT, occupational therapy, behavioral therapy, great structured play therapy to really support the kiddos with ADHD to develop the life skills that they're going to need as little people and as big people. Because, I think another myth that I don't know if you're getting to it is that you grow out of ADHD. Yeah, some people grow out of the criteria for ADHD, but unless your brain changes, and there's neuroplasticity, usually the symptoms can get masked, or you can no longer meet diagnostic criteria because you've developed such great coping skills. But more often than not, the vast majority of children with ADHD have ADHD in adulthood. And that's really when we have to think about medication for ADHD as something that's been around a really, really long time to work along with the behavioral therapy. So, behavioral therapy is often the first line, meaning we want to teach our kids and grown-ups organizational skills, how to self-monitor, how to self-regulate. Really great cognitive behavioral therapy approaches have been made for executive functioning, literally the things that ADHD people struggle with. For kids and honestly a lot of adolescents and young adults, there's also many programs around social skills trainings, in addition to the executive functioning, to really learn how to navigate relationships, how to make friends, how to keep friends, right? How to function at school and in other social settings. So there's a lot of support around behavioral therapy. But it is a neurological condition, and we know that through decades of research that stimulants are also really, really, really effective. In the vast majority of diagnoses, people report that they feel better when they're on medication. The challenge is finding a medication where, in for the clients that I've worked with, finding a medication where the side effects of the medication don't outweigh the benefits. And that's really the challenge, and that's why it's so important when you have a diagnosis of ADHD to really work with a trusted psychiatrist, a trusted neurologist, someone that really, really understands ADHD and its friends, anxiety and depression. So stimulants are typically the first line of medication that's used. And because they are a class of medication that is a controlled substance, I think a lot of parents and a lot of grown-ups are ambivalent about it. They're not sure they want to start it. We hear about it being an appetite suppressant, about kids having really negative responses, and that can happen. And that's not to say we shouldn't try medication, because there's decades and decades of research that it is typically safe. And again, I'm not a psychiatrist or a neurologist. I'm not a doctor here. I can just say, as a clinician working with people who have taken medication, they report feeling better on it. One client said it was like the sunglasses coming off. They felt like they were walking around with sunglasses their whole life. And then one day they tried stimulants as an adult, and it was like the sun.
I'm just, that analogy to sunglasses is really powerful. It kind of really hit me, right? Like, can you imagine walking through the world like that and not even realizing it, or like walking through the world colorblind and you don't get that everybody sees something that you don't see. And all of a sudden to be given this opportunity to see the world the way everybody else kind of sees it and to operate and function better and feel better about how you're operating in the world. Yeah. Okay, so I'm not going to touch on all of the myths, obviously, but I do have one last one, and I'd love to hear your opinion on this, that ADHD is a disability. Awesome. You mentioned before the risks of going undiagnosed or untreated, but we didn't really get to address it so much. So I wonder if you would spend a couple of minutes talking a little bit about what what those are. Okay, so I think as we wrap, I was writing notes for all the resources that you mentioned. I'm going to read them back to you and then ask you if you have any other resources that you would recommend. So the first was Dr. Russell Barkley. I've definitely seen videos of his. He's really amazing. He says things in terms that I think are really clear to understand. Um, and then Jessica McCabe, she recently came out with a book, How to ADHD, and I think you said she has a website, YouTube channel, etc. And then you mentioned CHADD, CHADD. Can you tell us more about that? Great. And then you mentioned ADD to like Attitude magazine. Okay, so as we wrap, what are three things that you want people to know and remember about ADHD? Awesome. Thank you so much for sharing your wealth of knowledge with us here on You're Such a Great Listener for October's ADHD Awareness Month. We'll try to drop some of those resources in the show notes and can't wait to see everybody next month. Bye, guys.
Thanks so much.